Alliance. Thank you for joining us this evening. My name is Rasha Chavez Cardenas, and I'm the Director of Strategy and Partnerships with Civic Health Alliance. Dr. Eileen Barrett is today's co-host and is a representative of the American Medical Women's Association. Dr. Barrett is an associate professor of medicine and director of continuing education at the University of New Mexico. She earned her MPH from the University of North Carolina at Chapel Hill and her medical degree at Georgetown University, and completed her internal medicine medical residency at Oregon Health Sciences University Hospital. Dr. Barrett is an elected member of the Gold Humanism Honor Society, a recipient of the 2019 Exceptional Mentor Award from the American Medical Women's Association, and a recipient of the 2021 Award of Excellence in Humanitarian Services from the Society of Hospital Medicine. So thank you, Dr. Barrett, for being a co-host. Thank you to the American Medical Women's Association for co-hosting this with us and allowing us to do this together. So as we prepared for today's webinar, Dr. Barrett, do you want to say anything or no? No? Okay. I immersed myself in The Political Determinants of Health by Daniel Dawes to prepare for this webinar. And in that book, he investigates how politics and public policy influence social conditions and health outcomes. Since beginning that text, I've been ruminating over the through line between civic engagement, political power, and public policy decisions and the impact that has on how people live. I wonder how we work to get and keep communities civically engaged to ensure that their needs are being addressed. So today we'll discuss just a small piece of this and seek to understand the relationship between civic engagement and health, uncover how healthcare delivery organizations can increase civic participation in their settings, and show the connections between policy and health. Civic Health Alliance is a nonpartisan organization. Next slide, please. So we would just like to remind you all that we're a coalition of health and civic leaders advancing health through and civic engagement in care settings and communities. So to get things started, we wanted to make this a little interactive. Could you please share in the chat one thing you've done this year to advance civic engagement in your care setting and or community? And we'll be looking at the chat to see what you guys post in the chat. Ooh, someone's encouraged patients to vote. Okay, what else do we have? Oh, someone sent out postcards. You joined Vote ER. Yeah, they're a great partner of ours to talk about voting. You've registered a person to vote. Okay. That's awesome. Our next question is, letters to registered voters through Vote Forward. I like that one. One thing that I've done this year is I have personally answering that I have signed up to be a poll worker here in my home county. So hopefully I can get all trained and participate that day and be on the ground as a poll worker. Discuss with colleagues and encourage them to plan how they vote. Oh, passing policies in professional organizations to promote inclusive voting. All right. This is cool. And then another follow-up one is, what is one of the most creative ways you've seen people help get out the vote? Door knocking. Hosted voter registration at the medical school. All right. Y'all are active. Getting HHS to include, voter registration. Yeah. RX pads. Ooh. Shauna Butler produced a podcast on voting and health. Can you put the podcast in the chat so we can watch, please, or listen in? Presentations on voter registration events in university dorms, or frat sororities. Yeah, I really like these. Okay. So to keep this interactive and engaged, we have a polling question for you. And that is, I'm more civically engaged than 5 years ago. Yes or no? Watching the data live is cool. Yes. Looks like most of you. Yes. Yes, that's exciting. Very exciting. All right, Faisal, we can go ahead and end that poll. We'll kick it over to Dr. Barrett.
Thank you so much. And thank you to everybody who is committing your time today to learn more so that we can learn from each other in addition to from our expert panelists. And I'll be introducing them very briefly in a moment, and then they'll tell you a little bit more. I wish, though, first to really just extend my or to speak a little bit about my profound gratitude to the work that the Civic Health Alliance does and how truly inspiring it is to me personally, and how grateful I am that I was able to have a conversation about preparing for this webinar with Russia and just learned so much from her. So this is really going to be a treat this time together. And I would like to also add that I would like to welcome everybody who is here, with a special welcome to those who are also members of the F.A.M.W.A Advocacy Committee, because this meeting is being held at the same time as our usual committee meeting would be. And that's because, of course, we want to meld the mission and the work of F.A.M.W.A with the work that we all want to do to help the patients, help our peers be more civically engaged, help each other too. So with that, then, I'm moving forward for the real reason, of course, why we're here is these remarkable and remarkably accomplished, both inspired and inspiring leaders. And although they will tell you a little bit more about themselves, what I will let you know about them in this case is that Ms. Jeanne Ayers, that she leads Healthy Democracy, Healthy People, which is a coalition of 11 public health organizations that is committed to advancing health and racial equity by strengthening civic and voter participation. And she's been deeply involved there and has held leadership roles in state government public health for over 9 years, and served as the Wisconsin State Health Officer and the Assistant Commissioner and Chief Health Equity Strategist for the Minnesota Department of Health. She was also selected as the 2010 University of Minnesota Johnson Human Rights and Social Justice Award winner for her work, and was responsible for developing the Minnesota's DOH award-winning report on advancing health equity in Minnesota. So really excited to learn from her. And then also moving left to right on our screens, and also excited to hear from and learn from Ms. Jessica Rebaza, who she's a third-year medical student, and so really starting her leadership trajectory really early, and is another change maker. She's a medical student at St. George's University School of Medicine. She received her bachelor's degree from the University of Georgia in nutrition and her master's degree in community health education from Columbia, where she also became a certified health education specialist. And her work experience includes being a nutritionist at the Women, Infants, and Children program, a public health intern at the New York City Department of Health and Mental Hygiene, and a COVID tester at multiple mobile clinics throughout Atlanta, Georgia. So really doing the work that needs to be done. And then lastly, and I know you'll hear more from them, but that it's also a privilege to introduce Dr. Theresa Rohr-Krichgraber, who is a professor of medicine at the UGA Medical Partnership in Athens, Georgia, where she's teaching faculty. She's a medical educator, a leader, and also a role model. She is the first Hispanic woman president of the American Medical Women's Association, so a trailblazer in many regards. She graduated from Cal State University at Long Beach with a degree in chemistry, received her MD from Weill College of Medicine at Cornell, and completed her medicine residency at the University Hospitals of Cleveland. So with that, I know that they're so much more than what I said just briefly there, but I'd love us to hear from them. So I will ask each of them if you could take maybe 2 minutes to share a little bit about yourself, a little bit more in your introduction, and how you work at the intersection of civic engagement and health, and also why. And so maybe we'll go in the order of Jessica, then Dr. Rohr, and then going next to Jeanne. Thank you.
Thank you so very much for that introduction. So I'm Jessica, and I am the Director of Social Media here at Civic Health Alliance. My biggest project that I work on is on the RX vote prescriptions, which I've been able to translate them in Spanish, and we're working on other languages as well to have more inclusivity when it comes to voting. I additionally created them to be more customizable, to include branding for other organizations. So just like the one that we did for F.A.M.W.A, we've done them for Doctors for America, Women in Medicine, and other organizations as well. So that's my biggest project that I'm most passionate about right now. Thank you.
Hi. So, I've been kind of all over the country, but probably within the most, I've never really got so involved with politics, I guess you could say, until like the last 5 or 10 years. I think especially when I started to realize that I had patients who couldn't get the work that they needed to have done because they didn't have the health insurance, and that the public safety hospitals were great, but there was still this huge swath of folks where they just couldn't be cared for. And when I started to really understand the difficulties for those patients, I wanted to do everything I could to get them the care that they needed. And that means making sure that we have changes in the policies that affect their day-to-day lives. So along with other organizations and along with multiple different groups, and also just reaching out individually to the patients that I see in the office. But I'm really proud of the work that AMWA has done to bring us forward and to make all of our members understand that it is not only a privilege, but a right and a necessity to have us vote as well as our patients.
Thank you. I'm Jeanne Ayers. I'm, as Eileen mentioned, I'm currently the Executive Director for Healthy Democracy, Healthy People. I really feel that my commitment to democracy began growing up on a farm in central Minnesota. I'm a 4th generation part of the family on that farm. And everything about the way we lived had to be figured out with our neighbors. And that was decisions at a state, local, and national level, which kind of created the conditions that made our lives possible, including electrification and roads and whether or not we were going to bus people to school from the country. Everything had to be negotiated. And so I thought that was what democracy was like and what it was always going to be like. And over the last, 30 years, it's been a disappointment that we aren't in that sort of robust policy decision making at every level, like we're not all showing up for that. So anyway, that's just a little bit about my background. I'd say that my professional background has been very much focused on the mission of public health, which is what we do collectively to assure the conditions so that all people can be healthy. And my focus for the last 15 to 20 years has been, how do you build the power to make that happen? And there are 3 practices you can use to build power, and that I've been learning and practicing in all of the various roles that I've held is a political appointee in governmental public health. And the three practices are organize people and organizations. That's why I'm so appreciative of the Civic Health Alliance and the partnerships that are coming together around our work in healthcare, and organize policies and resources at every level. And when you put badges on and you get your organization to support putting the badges on and registering people in your work settings, you're organizing resources, you're organizing policy, and organizing the data and narrative. And that's something that I think public health has a special role in. And I'll talk a little bit more about that later. But in 2020, when we're faced with a pandemic and we were faced with a historic election, we brought 11 public health organizations together who all had membership, at the national and then the state and the local level. And we showed up to promote voting. And then that's how we became Healthy Democracy, Healthy People. And we used those 3 practices. And so I'd love to talk more about that, but that was my little spiel on who I am and what I'm doing.
Thank you. Thank you all. So just kick off, get your expertise. I'm going to try to ask you as many questions as I can cram in quickly. So Dr. Rohr, can you speak to the real impact of policies on the health of those who seek and deliver care at an individual level?
Oh, absolutely. And it's not, it's even more so apparent now. I think in the past, many folks didn't quite understand how policies affected because we didn't always see those patients in our offices. If somebody couldn't afford care, they were kind of stopped at the front desk before they even got in. But as I started working more with the free clinics, let me tell you a story. So it's such a distinct difference. I had one woman who I was seeing in the free clinic, and it was totally free, like they weren't going to charge them or anything. And she came in with a breast mass. She was about a 40-ish-year-old woman. She had a breast mass that had been there for about 4 to 5 months, but didn't have a job, and so she didn't know how to access care. Now, she just was able to get a job, and so she was looking forward to it, but she kept hoping it would go away. It wasn't. At the same time, almost at that same weekend, I got an email from one of my patients who I was seeing in the office, and her husband works with me, so I got an email from her the day before. She had felt a little something in her breast. For her, I saw her on Monday. We had her mammogram the same day. She had a biopsy within 2 weeks. She had her surgery and she was done. Both of those women had breast cancer, but because one had insurance and the other didn't, their course was going to be significantly different. Those are the types of things that you start to realize it isn't just what I want, but it's the fact that certain states didn't incorporate the Medicaid expansion. And that changed how we could deal with people. And moving from one state to another, I moved from Indiana to Georgia, I still see day in and day out the impact that makes. In Indiana, we were really focused on the fact that we were trying to get the companies and the politicians to understand that you need a healthy workforce. If you don't have a healthy workforce, then the companies don't come to your state. And it was interesting that we really had to kind of force it from that direction. And I know we're going to talk about the Dobbs decision. So again, that's going to bring us right back to you and your patient. You think you're the only ones in the exam room, but you're not. Now you have all the legislative bodies in there with you.
That was going to be my next follow-up question, because you mentioned the Medicaid expansion example. And so I was going to say, can you talk more broadly now about, specifically the impact policies like the Dobbs decision, what impact they have on health and healthcare settings?
Well, we're seeing it very, very soon. I mean, it depends on what state you're in, but let me give you an example. In those states that have a total abortion ban, your physician is criminally liable for even bringing up something that could technically cause a termination of your pregnancy. So let me give you an example. About 6,400 pregnant women every year get diagnosed with cancer. 6,400 pregnant women get diagnosed with cancer every year. So if I am in a state like Texas, for example, and I'm the physician and you come to see me and I'm diagnosing you with a new cancer, I cannot discuss with you the medication that would save your life, because that could cause an abortion or termination of pregnancy. I can't even talk to you about the fact that it's your choice. Do you want to terminate the pregnancy, try the medication with it, knowing that it can terminate the pregnancy? Do you want to just, avoid treatment at all? No, I can't even talk about it. I have to find a different agent that's not going to work as well. If I do bring it up, I'm criminally liable. Criminally liable. I can go to jail, and my malpractice insurance doesn't cover that. Malpractice doesn't cover you for criminal liability. The risk management program for my institution's not going to cover me, because that's not what they do. They protect the institution. So over and over again, we're already seeing instances where women are having complicated pregnancies, and they're not able to get the care that they need. Just recently in Texas, again, with the total abortion ban, a woman was bleeding out after having an early miscarriage, but there were still, the products of conception were still in her uterus. There was still, quote, a beat. Because there was a beat, they had to just let her bleed until the beating would stop. Now you hope that the beating is going to stop before her heart does. And in her case, it was okay. But that's the kind of thing that we're having to face every single day. Every single day, it should be between you and your patient. But now we have legislations and rules and everybody else in that room. It's way too crowded in there.
Mhm. I like that saying. It's way too crowded in there. Having given birth myself, I couldn't imagine one more person in that room, and I don't want another one in there. Um, we're going to kick you off with you guys another poll. And I think what you picked on, Dr. Rohr, is a good segue into this question is there's a growing understanding in healthcare of how policies and politicians who enact them impact our health. Like, how many people are really in the room? Is that a yes? No, I don't know. Mhm. I don't know if you guys can see the result that I can see. It's mostly a yes. I think like most people think there is a growing understanding. And then there's a couple of no's and then a couple of I don't knows. And so that tells me that we probably have some work to do. And that conversations and discussions like this are important to continue to have. I'm going to go on with another question. And this one is for you, Jeanne. Can you kick us off and introduce the connections between health and voting through the lens of the Health and Democracy Index? And also, can you tell us why it is essential to promote voter education in these healthcare settings?
Yeah, thank you so much. First, we've already just discussed some healthcare issues that are always on the ballot. You know, Medicaid expansion, reproductive rights and freedom. There's just a multitude of them that we see, and then there's a whole lot that we don't see that come on and happen in the budgeting process, and in whether or not your state applies for a waiver for a thing, and whether or not there's work requirements for Medicaid. There's all sorts of policies that are happening at every level. And we know that our health is created through housing and access to education and public safety and economic and food security, and in addition to the healthcare access kinds of issues. So we often call those the social determinants of health. That's one of our public health terms, as we say, those are the social determinants of health. But the thing that I want to stress is that the social determinants of health don't just happen. They are socially determined through political processes, through decision-making processes. And those processes decide who does and doesn't have access to the vital conditions that are necessary for health. These are decisions that we're making either by participating in that decision-making process or making by not participating in the decision-making process. So that gets to sort of the reason why this is so important for us and for our patients and our communities, is that there's really no agnostic space in terms of assuring health and health equity. We have to be part of these decisions, or we're part of letting whatever happens happen. So that's my sort of basic premise. So in 2021, we are sitting here post-election. We should have been celebrating the historic turnout. It was incredible. Everybody came out and made sure that we expanded ways that people could vote and all of that. And anyway, I could talk about that a long time, but 161 million people voted. It was the highest voter turnout that we'd ever had. And it was, and 1 million people voted by mail. Lots of good things happened. So we thought, what can we do at this moment in time, this coalition that I mentioned? And we said, well, one of our things, we're public health organizations, is we can organize the data and the narrative. We can help tell the story about why inclusive civic participation and voter participation is important for our health. So we did the analysis. We call it the Health and Democracy Index. Please look that up, or you might want to share that link, Health and Democracy Index. And we looked at 12 public health or health indicators. That were everything from self-reported health to your state's health ranking to disability. So there's 12 health indicators and voter turnout, and we compared them to the cost of voting index, which is how easy is it to vote. And we looked at all the different states. So we did this across the country. We had been citing studies from international studies that said wherever there's more inclusion and more engagement, people are healthier. But we thought, let's look at this in the United States. And actually, we were a little blown away, even though we thought this was going to be the case. When we looked at the analysis and we plotted out on the, on the x-axis, the access to voting across the axis, and on the y-axis, we plotted out health and poor health, from best health to poor health. The pattern was so consistent, where the states where we had more inclusive voting practices enjoy better health outcomes. And the ones who have put more barriers into place for civic participation had worse health outcomes. And it was, and when you look at that index, you can sort by different health indicators. You can sort by looking at all the detail on a particular state, and you can look at the policies. And you can sort by the various policies that are creating those differences. So that was just it was us, our coalition, working with a lot of other partners to organize the narrative, organize the data in order to tell the story. And we feel that that's an important role that we can all play, and it makes it more possible for people in healthcare organizations and health funders and public health organizations to step into this space and say, we have a responsibility to create healthy, inclusive communities by assuring that people have access to voting and looking at more inclusive voting policies.
Thank you, Jeanne. This leads me to ask a polling question, and that is, what you talked about was about the ways people can be engaged, and you also touched on the fact that health goes beyond just the health policies. You mentioned food, you mentioned transportation infrastructure, you mentioned housing infrastructure. And so the poll question I have for the group is, civic engagement is one way we can protect our health. Do you guys agree, disagree, or I don't know? This is a strong agree, y'all.
Yeah, how many times can we take the poll?
Then you're going to skew all the data, Jeanne. No, it's a strong agree. I think that we all are starting to understand, or at least understand that civic engagement is one way that we protect our health. And that leads me to a question for you, Jessica. Can you share how you use your knowledge of care at the individual level to help inform local, state, and federal civic engagement?
Yeah, so I wanted to share 3 little stories. So one is going to be a family one, a friend one, and a colleague one. So my family one is last month, I actually accompanied my mom to go to her primary care physician for her annual visit because I'm interested in primary care. And so I went with her and I brought the RX prescriptions just in case. And you know how moms are, they love to brag about their kids. Oh my God, my daughter is this and she's doing this. And most of the time it's kind of cringy, but this time she really helped me because she said, and she works for an organization that helps people vote. And boom, that opened the door for me to have a conversation with this physician about voting. And I brought the prescription card. So I said, yeah, we are a nonpartisan organization and people can scan the QR code and register to vote. He took all of the prescriptions out of my hands and he said, I love this idea. So now in a small clinic in Noonan, Georgia, we have these RxVote prescription pads. And that just like gave me a lot of inspiration to talk to our families and friends about voting and give them these RxVote prescriptions so they can help initiate that conversation. Because once that starts happening, then individuals who may not be thinking about this, healthcare workers, are now like, oh, my patients are talking to me about voting. Maybe I should talk to other patients about voting now. So my mom has a stack of these RxVote prescriptions in the house to take them to her next appointment for whatever she goes, whether it's a dentist or an annual screening, or just individuals that she knows in general. So my second one is a friend one. So when I do this job, sometimes I'm always like looking for new ideas. So I'm brainstorming with some of my friends. One of my friends that I usually kind of tell all my things to is my friend Austin, who is joining us today. And I talked to him about the RxVote prescriptions. And I said, how do I get these in people's hands? And he used to be a paramedic in the emergency department, and he's rotating in the same hospital where he was paramedic at. And he said, one of the ideas that I have is that imagine if every person that got discharged from the emergency department at his hospital in Detroit got one of these stapled to the back of their discharge papers. So now that is an idea that a medical student thought of, and he asked his manager said yes. And he gave examples as to why it was important. And now the next thing is going on to talk to his director about, implementing that. And then my last one is a colleague one. So this happened actually on Monday. Monday, early voting started in Georgia. I'm a Georgia resident. I got my absentee ballot in the mail, called my parents on the way to the hospital, and I said, hey guys, just remember, you got to go vote today. So I was really pumped up about voting. And in between waiting for our attending to do rounds, it was myself and 3 other of my colleagues. And I just said, hey guys, quick PSA, like you should probably order your absentee ballots now, just in case. And it opened the discussion for voting. So one of the students said she really likes voting in person, so she's going to wait until election day. Another student said she enjoyed voting by mail, so she had already ordered her absentee ballot for herself and her husband. And then the third student was kind of weary about voting. They had voted in the past, but because we're all international students, she was like, well, I've been living abroad for so long. And then I was studying for STEP in California, and I don't even know kind of where I'm supposed to vote. And I said, well, where is your permanent address? And she said, Alabama. And I said, okay, where do you have an ID card? She said, Alabama. I said, where's your family at? She said, Alabama. I said, you're an Alabama voter. And she was like, well, I don't know how to do it. Quickly, I airdropped our special link that we have, our vote.org link. I airdropped it onto her phone and I said, register to vote. While she was doing that, I was just double checking the deadlines. The deadline for Alabama is October 24th. So she caught the deadline just in time. And then I downloaded her absentee ballot application so she would know how to fill it out and kind of ease that, since she didn't really know how the process worked. So that's just a couple of examples of how to engage people at the individual level to talk about voting.
Thank you, Jessica. I have a follow-up question for that, and that is, what gives you the confidence to have these conversations and ask these questions? Because we often know voting can kind of touch the political, we don't talk about politics, it's one of those things that we don't talk about. So what is giving you that confidence to have these and hold these conversations with these individuals and these examples?
Yeah, honestly, a lot of the work that I'm doing here at Civic Health Alliance, I'm just learning so much about voting. One of the things that I kind of lead with is that I work for a nonpartisan organization. So I don't care who you vote for. I just care that you vote. Mm-hmm. Another thing is that, the fact that physicians overall vote less than the general public. And that's something that interests a lot of the medical students that I am talking to. So I kind of lead with that, and just a little fun fact, try to make it as short and sweet as possible and not get too deep into it.
Thank you. This question is for any of you all to answer. And I've been watching the chat. It's going crazy right now. So if I could multitask, I would answer all those questions too, but I see you guys in the chat. So for anyone on the panel, what has been one of the most effective ways you've seen to engage peers and patients in voter registration or other civic engagement efforts in healthcare settings?
Well, let me just tell you one quick story, because I definitely think we have to make it very, very personal. So just like Jessica helped her colleague to do it right then, we had a patient in the office who was being seen because they were finally able to get some charity care, but that charity care was only going to last 6 months. And they had some pretty nasty COPD or emphysema. And so after we're figuring out what we're going to do for her and how we can get as much done within 6 months, I said, are you registered? Well, no, haven't voted in a long time. I said, well, just think about the fact that if Georgia had gone through with a Medicaid expansion, you might have been eligible for that many years ago, and you wouldn't have had to delay care, and you wouldn't have to try to get it all in 6 months. So think about the fact that you need to get registered and you need to vote in such a way that you could be eligible for Georgia Medicaid. And I said, I can't tell you who to vote for. And then like later on, she pulled me aside. She goes, okay, but who should I vote for? So I said, well, okay, let me just tell you where different groups are standing on this Medicaid expansion. But I think, she wouldn't have thought about the fact that that ruling made her health care, unable to be obtained, So I think we have to make it very personal. The other is, when I was doing an advocacy course in Indiana, and the students were all advocacy, I said, well, where are you registered? Well, and they weren't quite sure, because a number of them were from out of state. And they thought that if they were out of state and not paying in-state tuition in Indiana, that meant they couldn't register. I was like, no, we need you here. So right then and there, we had them register where they were living. So even within the medical school, a couple weeks ago, we realized that the last day to register for Georgia was last week. And within a couple of days, the medical students put together a register to vote table. They brought food, because that's always going to bring some folks to stop by if you've got free food sitting out there. They brought baked goods and food, and they registered about 15 students who hadn't been registered yet. So I think it's about making it very personal, bringing down why, and then also giving opportunities so that it gets taken care of right away, which is why the QR code and all that has been so helpful.
Yeah. Thank you, Dr. Rohr. I really like that example of the Medicaid expansion example, because you were able to show the through line to this patient. This is the medical issue you're experiencing. This was what could have resolved that medical issue. This is the policy issue. This is the health policy issue that people are talking about and are voting on. I'm sorry if you hear the background, right now. And so I think that through line that you brought, very personalized, is helpful, but that also requires knowledge, and it also required you to stay up on the issues, and it also requires you to be engaged and to know what's happening. So thank you for that. Does anyone else want to answer that question? I'll leave it to anyone else. Jessica, Dr. Jeanne.
Well, I just want to second and third the innovative approaches that the Civic Health Alliance with VoteRx and then Vote ER with the badges, and A Healthy Democracy, Healthy People also created a set of tools called Healthy Voting Guides. So when you have people from whatever state, you can just look it up, and there's you can have, anyway, that's a tool, healthyvoting.org, which is being used in a number of health settings that might not be healthcare settings, but in WIC clinics and other kinds of service settings. I think that all this direct registration work is really important at this moment. And then after the moment is over here and we get to late November, I really want to encourage everyone to begin bringing your coalitions into promoting inclusive policies, same-day voting registration, the automatic voter registration when you enroll in Medicaid. I think of the difference that could make. And there's just a lot of policies that would help make things more inclusive. I just wanted to. I think we're one of 9 countries in the top 40 top countries in democracy or whatever that don't register everyone when they turn 18. So the fact that we have to do all this work, all this lifting to get people registered, why is that the assumption? Why aren't we just all registered? So anyway, just want to plant that seed for post-election engagement.
I have a question about that a little bit later. She's jumping ahead over here. I have a poll question for you all that are tuning in. Are you or your organization interested in receiving support to set up a voter registration site in your settings, like the ones that Dr. Rohr has talked about, or the examples that Jessica mentioned? And then the follow-up question is, if yes, are you looking for advice, a partner, or both? And the reason we're asking that here is because we've got lots of partners and lots of resources on this call. And so we would like to continue to have this conversation and engage you all and expand our partnerships and collaborations to see what's the appetite. So it looks like yes. And many of you are looking for advice, partners, kind of both. It's mixed, but it's a yes. It's a largely a yes, and it's a mix of advice or a partner or both. So you have our contact information now. Dr. Rohr, Jeanne's, Dr. Barrett's, myself, Jessica, Civic Health Alliance. Reach out. We'll be in touch to figure out how we can support that. I have another question for the panel. I want to scroll down to it. Let's see. How do I get over here? This is another question. What do you suggest healthcare providers tell their patients or colleagues when they question if there's a place for voting and civic engagement in healthcare?
Yes.
And this is anyone. Mhm.
Yes. But I think,
Yes.
we need to give them ideas and examples. When reproductive choice gets blown away, it's not just the fact that there is less access for abortion, which is obviously the case, but they don't see the downstream effects that family planning clinics close because they're not able to provide the services. That will then increase your unplanned pregnancies because it's harder to get contraception. It's going to make it harder to do the cancer screening that a lot of the family planning clinics do, which is cervical cancer screening, treatment for STDs, breast cancer screening. And so they don't think about that. And so, especially in some of our states, Georgia's one of them, Indiana's another, we have counties where we do not have any OBGYN service. And in many places, it was the family planning clinic that people were able to get some of those services from. Can you imagine being a 16, 17, 18-year-old young girl thinking, I better get my birth control, and having to go to a family planning clinic and where everybody's outside with signs yelling at you and I'll adopt your baby, and you're thinking, I don't want to have a baby, that's why I'm here. But to have to then go past that kind of thing, even if the site is still there. I mean, those are the kinds of things that one-track mind doesn't take into account. So I think we have to, as healthcare professionals, be very, very descriptive and very pointed. I'm sorry, I have to give you this one other example. One of my relatives called the other day. She's younger and she's kind of on the right-wing side. But anyways, she goes, oh, I've been putting off getting my PAP. I finally just decided I couldn't find a doc. I just decided I went to Planned Parenthood. And I said, oh, thank goodness. You probably didn't realize that that's part of what Planned Parenthood did, is that they were able to provide you a pap smear because they're open and available in California. Unfortunately, in some states, that's not the way it is. So please continue to go, continue to talk about it, continue to tell people about the fact that you were able to get screening good GYN care that had nothing to do with abortions because you had a Planned Parenthood in your neighborhood.
Mhm. Yeah. Thank you, Dr. Rohr.
I'll chime in here. One of the great things that Civic Health Alliance offers is our legal guide. And our legal guide basically says that organizations or institutions that accept Medicaid or Medicare have to provide voter registration. And I'm like reflecting on my time when I worked at WIC before medical school on how our WIC clinic actually did voter registration actively. So anytime a participant came in to register for the program or re-register annually, we had to offer them voter registration. So they would say, are you registered to vote? Yes or no. Would you like to register to vote? Yes or no, and then sign. And that was for every single person. And at the end of the month, nutrition assistants would basically gather all of those voter registrations and mail them to the state. The state would then try to check how many people registered to vote at our specific WIC clinic and how many people were actually registered into the program to match it up. So that's one way that we can see that it's pretty routine. So if every patient that comes in as a new patient to a hospital or a clinic, and we do that as part of our intake process, like, okay, with your insurance card, identification, and then are you registered to vote? It's something that's really quick and easy, and you just like a yes or no kind of opportunity.
Thank you for both of those. I have a question back for the audience, and that is, it's a poll question. And have you participated in or hosted a voter registration event in your setting? Ooh, ooh. You guys could see, I wish you guys could see the results come in like I do. It's a dead tie. It's 50-50. Half of you have and half of you have not. Okay. I like this. Jeanne, you touched on this earlier, and so I'm gonna pitch this one to you. Do you have any thoughts or ideas on how healthcare delivery organizations move beyond voter registration to advance civic engagement amongst hospitalists and communities? You touched upon this earlier when you're saying, once we get past the midterms, this, you had some guidance. Do you have any others, and do you want to go deeper in on that a little bit, please?
Yeah, I think that earlier you and others really pointed out the impact of policies. And right now, working on voter registration is a little bit like working in the ER. We're working to address, a problem right now. But the policy environment that creates the inequities in voter registration and voter turnout and then subsequent representation are the same basically racially driven inequities that create health inequities and health and so it's important to try to figure out what are the things that we can do to move the healthcare industry, not just ourselves personally, but we're part of that. How do we tighten up and build our political muscle together and move our institutions? So just the workers in healthcare, along with public health, it's like 12% of the country in terms of employees in the country are in healthcare. So if we build our muscle, we also need to build the muscle and have the people leading our healthcare systems show up, supporting inclusive health, inclusive voting policies. And that's not easy. For those of you who've gotten the permission to put a tag on a discharge note, that's a good thing. Now, what are we going to do to have your organization's leaders show up to say, we want same-day voter registration. We want automatic voter registration in Medicaid. We want there's a whole slew of policies in terms of, until 2020, I didn't know Harris County only had one drop box. I'm sitting in Minnesota and I have like 4 drop boxes within 4 or 5 miles of my house. So who knew about these inequities? And so our healthcare systems are really powerful. And you're powerful inside the healthcare systems. So figuring out how do we build our muscle? That's, I guess, my biggest thing.
Thank you, Jeanne. We have a few moments left. I want to leave it open for questions and answers from the audience. So if you guys could pop any questions that you have for any of the panelists to answer in your in the chat, I'll briefly look at them so we can get some questions from you all for the panelists to answer. And I'm not sure if you guys asked anything earlier, so go ahead and copy it and repaste it, please. And while I'm waiting to see a question pop up in the chat, I have one, and any of you guys can answer this. Beyond voting, what are there other types of civic engagement that you think healthcare could be thinking about being more engaged in? And when I say that, I'm thinking, is it coalitions and coalition building, participation in public comment, town hall events, redistricting, writing op-eds, or other forms of communication focused on voting related and health related legislation or ballot initiatives? Are those areas that you think are next after we get to voting? And have you guys considered any of those?
So absolutely yes. And I think that probably most of us, because we're sort of preaching to the choir here, probably have done all of those things. The one thing that I was uncomfortable doing until more recently was actually making sure that I contacted all of my own elected officials, especially my local elected officials, and meet with them. Because regardless of what side of the fence they're on, I can relate some information that they may not know about. And as a physician, my voice carries some weight, and I have to be fairly upfront and direct and polite and not yell and scream, even though inside that's what I want to do. But it's really been fascinating that as you meet with people, you really get a better understanding of kind of like where they're coming from, but finding maybe a middle ground or finding some more information that they weren't aware of. But the other thing, quite honestly, is we hold small sessions for those folks that are running for office, but we also really encourage physicians to donate to the campaigns. We do have some physicians that are actually running for office. We need to be supportive of them as much as we can. And so whether it's about talking, whether it's about putting articles together, or just meeting, after this election is over, there's still going to be so much more work to do. Like was mentioned by our other two panelists, we're not done once the voting booths close. We have a lot to do, and meeting with our elected officials on a regular basis, sending them notes, letting them know how you feel, even if how you feel is the direct opposite of what they're saying. They need to hear that difference of opinion because they work for us.
Thank you, Dr. Rohr. There's a question in the chat that says, for the panelists, what is the future of voter registration at medical meetings?
That's an interesting question because I think that's a really good idea. The hassle is that most medical meetings, if they're not local, are very, multi-state, and every state's a little bit different. But we can still definitely be pushing that. I think that's an awesome thought. I'm going to a meeting this weekend, so I'm going to wear my badge, even though registration is over. I think it's a time to talk about early voting in the state of Georgia anyway. So absolutely, we need to do more of it.
Mm-hmm. Thank you. Jessica, I saw you getting ready to come off. What were you going to say?
Yeah. So one of the things that I've been working on with our F.A.C.P prescriptions is getting them out to conferences. So we did 2 large conferences. We did the Women in Medicine and also Doctors for America. We were able to send 500 of them to Women in Medicine and 750 of them to the Doctors for America conference. The good thing about our QR codes is that you can register to vote in any state. So even though they switched the location and people are coming from all over the country to these conferences, they can still register to vote on a more uniform platform. So that's one thing that I'm hoping to continue. And it'd be great if there's like more organizations that participate in that, where we can actually host voter registrations at conferences.
Thank you. Thank you. We have about 2 minutes left. Is there any other comment from the panelists that you guys want to make? Any last minute information that you want to share?
Sure. There's two really fabulous groups that we need to be working on, so that every new resident that starts on July 1, as part of their orientation packet, they should have a voter registration card, because they're going to be in that state for the next 3 to 5 years. Let's get them registered. Let's include it in all of our medical students. When they come in for that first year, they should have a voter registration card. That's one of the things that at least we're going to be working on within my own local institution and within our own local programs. The next line would be to include it with every human resources. So when you have a new person that joins your hospital, your company, your voter registration card should be in there as well. They might have moved in order to work there. So yes, we need to do those things and make it more on a regular routine basis.
Thank you. Jeanne, I saw you nodding.
And yes to all those good ideas. There's no reason why all the universities shouldn't be doing registration for all their enrolled students. But it would be great if the residencies did that and then turned around and said to the universities, you guys should be doing this too. The only other thing I was going to add is, and I think Theresa mentioned this, but to actually go see your elected officials, to talk to them about the things that you care about in between elections. When the session is going to start, we are going to see a massive amount of voter laws being passed. Some good, lots bad. We've already seen, I think 30 states introduce poor legislation post 2020. When I say poor, I mean more restrictive. So this is a contested area that's going to continue to play out in people's lives.
Yeah. Thank you, Jeanne. I know we're at 6:30 my time on the dot, so it's the time for all of you. Thank you all. On behalf of the American Medical Women's Association and Civic Health Alliance, I first want to thank the panelists. Thank you, Jeanne. Thank you, Dr. Rohr. Thank you, Jessica. Thank you for being such a fabulous co-host, Dr. Barrett. And then I also want to thank you all for participating, and for those who listened in for today's webinar. We hope that we have inspired you and your organization to consider ways of implementing civic engagement efforts in your care settings. Please complete the feedback survey and remember to vote in the upcoming midterm elections on Tuesday, November 8th, 2022. Thank you all and have a good evening. Bye.
Good night.
Good night.